Immigration policy impact. Elder care facilities face worker shortages. What if the next wave of mass deportations could leave elderly residents without the care they desperately need? Immigration policies targeting temporary protected status, TPS, are sparking a crisis in elder care facilities across Long Island and beyond. Advocates warn that revoking TPS protections for workers from countries like Haiti, Venezuela, Honduras, and Nicaragua, many of whom are essential to nursing homes and assisted living communities, could deepen an already dire staffing shortage. And here's where it gets controversial. The US government argues these protections were never meant to last, but critics counter that decades of reliance on these workers has made the system dependent on their contributions. But here's the twist. What happens when the people keeping our elders safe are suddenly at risk of being sent home? The Trump administration's push to end TPS, a program expanded under President Biden, has sent shockwaves through the elder care industry. Employees with TPS, who often work in roles like nursing assistants and housekeeping, are now receiving deportation notices, leaving facilities scrambling. They are very nervous, says Stephen Hance of the New York State Health Facilities Association. These are active members of the community providing essential care in homes already struggling with a workforce crisis. The Department of Homeland Security, DHS, insists it's time for TPS holders to return to their home countries, stating the program was designed for temporary use. But experts argue that for many, TPS has been a lifeline for over 20 years, and its sudden termination threatens to destabilize an industry already on the brink. The ripple effects could be catastrophic. Stephanie Woolhandler, a public health professor and co-author of a recent report on immigration and healthcare, explains, deporting legal immigrants and making it harder for others to enter will worsen staffing shortages. If nursing homes can't discharge patients needing long-term care, hospitals and ERs will back up, delaying treatment for everyone. The numbers back this up. Immigrants make up 37% of New York's healthcare workforce and 74% of home health aides, a proportion unmatched nationally. Nationwide, 28% of long-term care workers are immigrants, including over 820,000 individuals as of 2023. The pandemic already triggered a mass exodus of elder care workers, and immigration crackdowns are now complicating recovery. A 2023 report found 99% of nursing homes nationwide have open positions, with many limiting new admissions due to labor shortages. We have a growing number of older adults and shrinking workforce, says Subringer Barrett of Leading Age New York. Revoking legal status will only make things worse. Anecdotal reports suggest some workers are even avoiding work due to fears of ICE raids, though no confirmed incidents have occurred in New York. But what's at stake is more than just staffing numbers. Karen Lipson of Leading Age New York highlights the personal connections between caregivers and residents. Staff know residents' preferences and detect subtle changes in health. Losing these relationships means losing trust and expertise. The question remains, is it ethical to deport workers who've built their lives and careers in the US simply because their home countries have improved? Or does the system need to adapt to recognize the value these individuals bring? As the debate unfolds, one thing is clear. The elder care crisis isn't just about policies, it's about people. And the choices made today could determine whether millions of vulnerable seniors receive the care they need. What do you think? Should the government prioritize enforcing immigration laws over the stability of critical healthcare services? Share your perspective in the comments below. How refugees are transforming Wisconsin's nursing home workforce. In Wisconsin, a state agency has been turning to refugee workers to address staffing shortages in nursing homes, confronting new challenges brought by the Trump administration's policies. Refugee employees have been instrumental in bridging the gap in healthcare staffing, but recent shifts in federal regulations have prompted the organization Leading Age Wisconsin to rethink its approach to helping refugees find employment. The past few years have seen Leading Age Wisconsin actively onboard and train refugees to support the state's elderly population, representing nonprofit eldercare providers. Addressing the continuous shortage of healthcare staff by relying on immigrants and refugees has been one innovative solution by Leading Age Wisconsin. The organization's Senior Vice President of Clinical and Regulatory Services, Robin Wolzenberg, shared that previously, resettlement agencies would refer numerous refugees seeking placements in long-term care facilities. However, this is no longer the case. Wolzenberg's engagement with refugee workers began 3 years ago, spurred by the arrival of a significant number of Afghan refugees to the state. This prompted her to consider, why not engage refugees and immigrants? Many of them possess caregiving experience from their own countries, passed down through generations. This insight proved accurate, as 3 years down the line, refugees placed in positions have demonstrated about an 85 to 90% retention rate, significantly higher than the local workforce's turnover. As fewer new refugees arrive now, Wolzenberg emphasized, our focus is shifting towards supporting those refugees who are already established here. She praised their strong work ethic and their aspirations for the American dream. She believes that long-term care providers can play a pivotal role in offering them this opportunity. What's your take on this? Do you think more states should follow Wisconsin's lead in incorporating refugees into their healthcare workforce? Share your thoughts and let's discuss in the comments below.